Okay. Good morning, everyone. As people fill into the class, please share where you are joining from today, your field or library you work for in the chat. Okay, we got Baltimore, we got Chicago, South Carolina, Utah. Just keep filling in. Okay. Welcome, everyone. It's the top of the hour, so we are going to get started. Hello, my name is Shauna Hasty, and I am the Community Engagement and Outreach Strategist for Region 2. We are located at the Medical University of South Carolina in the Colbert Education Center and Library in Charleston, South Carolina.
Hi, everyone. My name is Benny Finch, and I am one of the Education and Outreach Coordinators with the NNLM in Region 7. And we are located at the University of Massachusetts Chan Medical School in Worcester, Massachusetts.
And my name is Lauren Whittick. I am the Assessment and Communication Librarian for NNLM's Training Office, which is based out of the Eccles Health Sciences Library at the University of Utah. I'll just be monitoring the chat today and sharing links throughout the presentation.
Thank you, everyone. Before we get into today's presentation, we want to share that we are able to offer continuing education credit through the Medical Library Association. At the end of today's session, we'll share the evaluation link, which is a first step in claiming continuing education credit. Today, we'll be talking about connecting older adults to health information. This training is designed to support the needs of libraries and community-based organizations. Additionally, we will also highlight the ongoing work of libraries to support older adults in ways that other professionals might consider partnering with libraries. We all know that libraries provide a convening space that supports engagement opportunities for older adults through special programming, reading groups, and volunteerism, free access to educational resources, digital literacy, training, technology, and when available, social support services to patrons regardless of age, background, or income. And libraries also provide opportunities for intergenerational activities that engages the whole community.
I briefly want to introduce the network of the National Library of Medicine, also known as NNLM. As the name suggests, the NNLM is part of the National Library of Medicine, which is within the National Institutes of Health. We are the education and outreach arm of the National Library of Medicine. We work regionally, getting to know communities on the ground and helping those communities serve the people they know best. We are also present across the entire country, and we work to advance the health and well-being of everyone through access and understanding of how to use health information. This includes working with organizations like libraries of all types, schools, healthcare, public health, and all sorts of community-based organizations. We do this through outreach, funding opportunities, and through offering free training like today. Today, we will mention a few available classes during the presentation. These are all free to take and will be listed in the handout. Back to you, Shauna.
Thank you, Benny. So let's look at our objectives. Today's presentation is going to cover evaluating older adult population data at the local, state, and national level, identifying health information resources to meet the informational needs of older adults, and also we'll look at developing ideas for library and health education programming that address the health information needs of older adults. Before we get started with today's content, I'm going to open a Zoom poll. We'd like to know what type of continuing education credit you're interested in today. We offer all the types you see on the slide, and you can choose all that applies. I'll give you a few moments to make your selections. Okay. All right. Give you one more few minutes, a few seconds, I'll say. Um, okay. And we're going to close the poll. So it looks like we have a great number of individuals who are here seeking MLA credit, Chiz and Chess. So we just welcome all of you all here today. So thank you, and we appreciate your information. So let's start with some population data. I'm sharing this graph created by the Administration for Community Living, taken from the 2022 census data to quickly demonstrate the growth in the number of older adults in the United States over the past century. In 2022, there were almost 58 million older adults in the United States. Of the approximately 330 million people in the US in 2022, 57.8 million were 65 and older, including 32 million women and 26 million men were 65 and over. People 65 and over represented 17.3% of the population. The projected estimate by 2040 is that 22% of the population will be 65 or older. And in fact, 4% are expected to be 85 or older. Now, I want to give you a chance to look at the percent of the population in your state that is 65 and older. So it's your turn. Benny's going to put a link into the chat, and it's also in your handout. After you have the spreadsheet open, look at the bottom of the spreadsheet. There are several tabs, and we want you to choose the tab that state percent 65 plus, and let me know which state you are from and the percentage of the population over age 65 in your state in the chat, and give you a few moments for that. Okay. Maryland, 16.9%. Georgia, 15.1, Arizona, 18.8, Arkansas, 17.8, South Carolina, 19.1. Okay. All right. And just keep sharing in the chat. Connecticut, 18.3. Very nice. And I'm like I said, the numbers are very consistent in what we are seeing on these on the chart. So we're going to go to the next slide. Thanks so much for sharing, but continue to share. It's quite a few of you all here. So we've looked at our individual states. Here's a snapshot of the percentage of the population of older adults across the entire United States in 2022. The percentage of older adults varies from 11% in some states to 23% of the population in others. Now, I'm going to turn it over to Benny, and she's going to demo a couple of websites that can provide health data regarding older adults in your county and more.
Yes, thanks, Shauna. So now that we have a sense of the older adult population by state, I find it helpful to get a sense of my local information as well. For our demonstrations, we're going to take a look at Botetourt County, Virginia. I chose this county because this is the county where I grew up. And the first site is County Health Rankings and Roadmaps. I like this site because we can see the data at the county level. So if we start here at the Health Data tab, we can choose Health Data by location. So here we could add a state, county, or a zip code, and I'm going to put in the county. So I'm interested in Botetourt County, Virginia, so I'll select that. And when we scroll down, we can find a map with the location of the county within the state of Virginia. There's some basic information below related to health behaviors and health outcomes. You can explore these data points for your own county later, but I'm curious about the demographic data for the county, so I'm going to scroll back to the top. And I'm going to open this tab called Show Demographic Data. And here I find the percentage of the population that's 65 and older. So for the state of Virginia, that number is 17.2%. And for the county, it's 24.6%. So here you can get a sense of some variability of the percentage of the population who are older adults in different parts of the state. So now I'd like us to take a look at a different resource called the Congressional District Health Dashboard. And for this demonstration, we will look at Buchanan, which is a town in Botetourt County. So this data is going to cover a slightly larger geographic area in the Congressional District Health Dashboard. And this time I'm going to enter a street address. So I'm going to enter 19795 Main Street. And, oh, sorry, 19795. There we go. Main Street in Buchanan, Virginia. And this is the address of the Buchanan Library, which is part of the Botetourt County Library System, which is the same county in Virginia we looked at earlier. And I spent many hours in the library when I was visiting. And so shout out to my friends at the Buchanan Library. But now I'm going to view our district. So let's take a look at the district. So we see a variety of health metrics, and this is going to be for that entire district, not just for the county. And it's also key to know that this health information is for all ages, not just older adults, but it's still useful for planning purposes and to explain why you might be choosing an activity or resource for your organization. So here we can choose from different filters on the left side of the page, and I'm curious about health outcomes. When I choose this, I get a list of specific metrics. So these are some things, again, I might want to pay attention to when looking for programming ideas. And health behaviors is another metric that I might want to consider when planning for my organization. So we've noted some health indicators in the county health rankings and congressional district health dashboard. There are also some common health conditions in older adults nationally. The list of the top 9 most common health conditions in older adults in the United States is from the 2023 Profile of Older Americans, developed by the Administration for Community Living. You may notice some common themes. Hypertension, high blood pressure, high cholesterol, and coronary heart disease are all related to the heart and circulatory system. Arthritis and diabetes are chronic illnesses. And we also see cancer and respiratory issues here. So now that we've looked at sources of health data nationally about our state, counties, more local data, we have some health issues in mind. So now let's take a look at some information resources that you can use to answer questions or share with library patrons. Medline Plus is one of the premier products from the National Library of Medicine. The National Library of Medicine, again, is one of the National Institutes of Health, which is funded by our tax dollars. And I'm not going to spend a lot of time going into all the details about Medline Plus and what's available here. We have other classes and tutorials that go into more depth about Medline Plus, and we have links to those classes on the handout. Today, I want to focus on finding information for and about older adults. So across the top here, we have our main navigation. I want to point out that you can turn the entire site into Spanish by clicking on the Espanol button on the upper right corner of the page. So that's great if you're working with Spanish-speaking individuals. We sometimes get questions about how Medline Plus is translated into Spanish. The Medline Plus Spanish team is made up of individuals who are native Spanish speakers and have experience in health, medicine, and biological sciences. Okay, now we'll head back to our English site. So if we look at this navigation bar, health topics is a great place to start. We also see a link for medical tests. I'm going to scroll down to the middle of the page. And we have those same navigation choices here. And then below that on the left, there's a link to easy to read health information. And that would be for all ages. Health information, multiple languages is also, again, for all ages. And there's also a link to clinical trials, and we're going to come back to that a little later. I'm going to click on health topics. So there are a variety of ways to search or browse this page. I'm going to choose demographic groups on the right side of the page. And here we see our target audience, older adults. When I click on that link, I'm taken to a page with approximately 200 health topics that address common health concerns of older adults. So just to give you a sense of what's available here, I'm going to use this arrow on the bottom right side of the page to go back to the top. And I'm doing that because my preferred way to find a specific topic is to enter it into the general search box in the upper right corner of the page. So when we looked at health concerns for older adults nationally, the #1 concern was hypertension or high blood pressure. I'm going to type in high blood pressure. You could also search hypertension. And go. So when I run the search, the top result is high blood pressure. We have some other results listed here about our topic as well. This information is being pulled from across all of the Medline Plus resources. So you can see here where the information comes from by looking at the URL. In addition, there are information about the types of information that are available in these results, as well as you can refine by format. But I'm going to click on this main high blood pressure link, and it takes us to what Medline Plus calls a topic page. So all topic pages are laid out the same way. There's a table of contents in the box at the top that includes a summary, a Start Here link, and over on the right side, there are videos and tutorials that you could choose. A couple of things I want to show you along the right side of the page is the medical encyclopedia, and that pulls in related links to additional health information. We're going to use our table of contents now to go to our Start Here resources. So there is a link to an article that's marked easy to read. And we sometimes get questions about plain language. And I do want to mention that Medline Plus uses the principles of plain language. The topic pages are written at a 6th to 8th grade reading level or below. And those links that are marked easy to read are written at a 3rd to 5th grade reading level. So just wanted to let you know that. Anytime you see this NIH logo, that means that resource is coming from one of the National Institutes of Health. There's also a resource from the American Heart Association. And you might notice this little camera icon. And in that case, it means that there's going to be, it's either video content or video content is part of that resource. Just to let you know about that. Scrolling down, there are diagnosis and tests and a number of other resources. Now I want to take a look at those multilingual resources. So if there are multilingual resources about your topic, they'll be listed on the right side of the page under other languages. So I had mentioned before that Medline Plus is available in Spanish, but in addition to this, there's a selection of resources that are available in languages other than English and Spanish. So here we see a handout on high blood pressure, and it's available in 13 languages. And I'm going to show you this bilingual document. It's a PDF. It's coming from Health Information Translations. And for this document, along the left side, the information is available in English, and along the right side, we have the information in Arabic. I'm going to head back to our health topic page. Okay. So I would want you to notice in the second section here, under For You, there is a link to patient handouts. And these are items that could be emailed or printed. So these are available in English and Spanish. And we find that nurses are often particularly interested in these resources for patient education. So there's a lot of resources here. While we're down near the bottom of the page, I also just want to point out that at the bottom of each of these health topic pages, there's going to be a date for when this was last updated. And for this particular page, that was January 22nd of 2026. So if you're curious about how recently information has been reviewed or updated, you can take a look at that date. Okay. We're going to head back to the top of the page. Okay. So I know we have a number of people who work in public health and may want to do their own research of the medical literature, or a librarian who might assist someone who wants to research the medical literature. When appropriate, Medline Plus includes a link to journal articles, and we see that in the research section. When I click on that link, I'm dropped down to that section of the page, and there are three free full text articles on the topic. So the last link in the journals articles section says see more articles. When we click on that, a search is launched in PubMed. So we are going to head on over to PubMed. And if questions come up, please add those to the chat and we can discuss those during our Q&A period. Okay, so PubMed is a biomedical research database, and it's another product of the National Library of Medicine, and it's for anybody in the world who wants to research the medical literature. If you look at the search box at the top of the page, you can see exactly what and how PubMed performed the search. We see a very long search string. And in order for us to get a better view of the search string, I'm going to click on the word advanced. And then we can go to the Advanced Search Builder page. If you scroll down to the History and Details section, we can see the search that was performed, even though we started in Medline Plus. So we see terms like prehypertension, hypertension, last 1 year. We see publication types such as patient handouts, guidelines, and clinical trials. We also see free full text, which means that your library doesn't have to subscribe to the journal to access the articles, but it also means that it's limiting the search to articles where there is free full text. So just keeping that in mind as well. I'm going to go back to our search results by clicking on the hyperlinked number in the history section. So right now that is 221. So this takes us right back to where we started with that Medline Plus initiated search. Now this is a very broad search, and older adults isn't part of the search, but on the left side, there are additional filters. Sometimes this is closed, so you would need to open this. And here we see that we could actually choose our age group. So I'm going to choose 65 plus. And now our results have gone from, I believe, 221 to now 159 results. You can also apply multiple filters over here if there are specific things that you are looking for. I also want to mention that you can always just go to the PubMed site and just add your keywords to the search box and then retrieve relevant results. And then those search details will show you exactly what and how PubMed searched for your topic. We don't have time today to do a deep dive into PubMed, but we teach a 3-part webinar series called How PubMed Works. We just taught those in June, and the recordings are posted in the NNLM YouTube channel. The classes are also available on demand, and we have another on-demand class called PubMed Essentials. We've included links to each of these class pages on the handout. Are there any questions about PubMed before we move on?
There was one, I believe, about Medline Plus. It was,
Okay.
has there been pressure to eliminate some of the languages available?
Not that I am aware of. I have not heard that, and I think that would be shared with us.
And then somebody says the age filter on PubMed does not limit to old adults specifically. The results include old adults as one of the populations. So just a
Okay.
comment.
Oh, thank you for that. Thank you.
And that was everything.
Okay, great. So I do want to show one more resource from the National Library of Medicine, and I'm going to use that Medline Plus page again as our jumping off point. So I'll head back up to the top. Okay, so you may get a question about clinical trials, and this particular Medline Plus topic has a link in the research section called clinical trials. That would not be the case for every health topic, but if there are clinical trials related to that topic, then you might see this link here. So I'm going to click on that link, and we're dropped down to that section of the page, and we see a link for prehypertension and for hypertension. I'm going to click on hypertension because that's our main topic. And when we go over, we find that there are 1,688 studies for hypertension that are not yet recruiting or recruiting studies. And just to point out, so clinicaltrials.gov is a website and online database of clinical research studies and information about their results. So the purpose of clinicaltrials.gov is to provide information about clinical research studies to the public, researchers, and healthcare professionals. The US government does not review or approve the safety and science of studies listed on this website. But again, if there are clinical trials that are relevant to the health topic, there will be a link here from that table of contents to check out what's available. So we teach an entire class on this website called clinicaltrials.gov for librarians, but of course anyone can register, and the class provides a deep dive into the website, and we are teaching that class in August. And we also have a class that's offered on demand, and we put those registration links on the handout if you'd like to register. The results, so we have 1,688. On the left, we can find more information here. So our condition is listed here, hypertension, in the conditions and disease box. And we can amend the original search by using these filters on the left. So we could use eligibility criteria. We can also add our location. So for this, I'm going to change the search to older adult. And I'm also going to enter a location. So I'm going to put in Houston, Texas. And then I'm going to apply filters. So now we've dropped down to 28 studies related to hypertension or high blood pressure in Houston, Texas that are either not yet recruiting or recruiting studies related to older adults. So just wanted to share that so you can get a sense of some basics of using clinicaltrials.gov. So that's all I'm going to cover in the demos of Medline Plus, PubMed, and clinical trials. As I said before, we teach classes about each of these resources, and those links are on the handout. But are there any questions about clinicaltrials.gov before we move on?
Nothing so far.
Okay, if you have things, please feel free to add those, and we can look at those in the Q&A section later. And for now, I will pass it to Shauna.
Thank you, Benny. So now let's transition into our discussion of programming ideas to consider. So where do we start? We are going to start with our initial planning phase, which it will take into consideration our primary audience, type of outreach, and available resources and capacity. We've already initiated the discussion of some resources to determine your community health needs and some informational resources, as well as you have the resource to learn about older adults in your area. And we have reviewed several informational websites and databases. Now you're at a stage where you would identify your intended audience. This may be a specific group of older adults with a specific health condition. Maybe the focus could be type 2 diabetes. I saw in the chat someone had chronic kidney disease. So next, consider the type of outreach or programming that is appropriate for this audience. Keep in mind, health outreach does not mean that you have to provide a 1-hour program with a speaker and activities. Think about the spectrum of engagement. and what a manageable and meaningful outreach activity might look like based on your audience's needs. It might be highlighting a particular informational resources such as Medline Plus. It might be offering a one-time programming or a series, or it might be offering some training. Finally, consider the staff capacity and physical space you have available and other factors. On the National Library of Medicine's website listing of available courses, we have a class called Health Programming at your library, and we have also shared that link on the handout as well. So now we're going to look at the 7 key questions to ask regarding programming. The who, the what, when, the where, the why, the how, and my personal favorite, the how much. This slide provides a blueprint of questions to consider for your programming. These questions are all multifaceted, but will help you recognize what pieces you have in place and where you will need to fill in the gaps. So we're going to start to look at the who. Think about who your primary audience will be. Who in your organization can assist in the planning and the program? Who else should be at the table? Maybe you want to consider who in your community might be an expert or might know an expert, and also who are potential partners for this outreach event. Now let's look at the what. What type of outreach activity do you wish to provide? Will you provide information or will you offer a program with a speaker? What are the community health needs and what evidence of this do you have? What resources are available from the National Library of Medicine or other agencies that you can use? Let's look at the when. When will you offer your program? When should you schedule programs so that your audience and staff are available? And will this be a one-time or ongoing event? Should it coincide with a health awareness or initiatives within your community? Let's look at the where. Where would the program be held? Do you have the space? Could this be an outreach to a senior center or local nonprofit? Is it accessible to your participants? What about, could this be an opportunity for your library to partner with an organization that may have resources that your library may not have at the moment, such as a large auditorium to accommodate the needs of your participants? Let's look at the why. Why do you want to offer this outreach activity? Why will this benefit your library's community? This is where those data resources can help guide you. Having the data to support the importance may help to procure funding and or other support for your program. Let's look at the how. How will you market the program? Will social media or flyers be included in how you advertise? How will you measure impact of your program? For instance, will there be attendance taken, pre-post surveys, newsletter, or social media posts? Back to the how much. This question involves looking at how much time you and other staff will have to invest in the activity and how much money will it cost. Going back to costs, are there partners who are willing to provide a program and or a space at no cost? Is there grant funding available? Are there resources you can borrow from your state library or another library if you are a part of a library system? I want to let you know that we've included a couple of those resources from the American Library Association that might help in your planning process, and we'll discuss that a little bit later. So next, we will discuss getting started with partnerships. Here, we have identified some partnerships that libraries in our respective communities have collaborated with. In the chat, please feel free to share some partnerships that your library or organization have partnered with or suggest partnerships that would be ideal for working with older adults in your community. And I'll give you all a few moments to think about that and add that to the chat. Okay, cooperative university, extension agents, churches, the toolboxes from the RMLs, farmers market, senior centers, on-campus clinic. We have senior centers again, public libraries, county health, statewide Black maternal health groups, okay, food bank, barbershops, beauty shops, FQHCs, YMCAs, rec departments. Okay, it says a lot of those YMCs have the Silver Sneakers programs, and that's definitely for older adults. Universities, aging organizations. Okay, these are great information, and feel free to keep adding to the chat. We found that this is also very helpful when others are thinking about doing some partnerships in their communities. So when you look at the getting started with partnerships, you look at that we have local government, and like I said, some of these you've already mentioned: public health agencies, healthcare providers, food banks, agricultural nonprofits, cooperative extensions, area agency on aging, and senior centers all provide valuable resources that may have the expertise and audience experience, materials or other resources that your program needs for success. With an audience and idea in mind, begin to think about who you might be able to partner with to enable or enhance the outreach or programming activity. And does this partner or organization align with the overarching goals and objectives of your organization? Additionally, using libraries as a program hub for partnerships could serve and provide a platform to expand the population reach of your programming goals. And so now we're going to look at the Healthy People 2030 focus areas for older adults. In the first section of today's presentation, we review the Congressional District Health Dashboard to gather health metrics by district and some common health issues among older adults. The Healthy People 2030 is another resource that we would like to highlight as we think about programming and some health topics you might consider. Healthy People 2030 is an ongoing project by the Office of Disease Prevention and Health Promotion. Healthy People 2030 sets measurable national objectives with 10-year targets to improve the health and well-being of all people. 20 of those objectives are specifically focused on reducing health problems and improving quality of life for older adults. The first Healthy People initiative started in 1990 and is updated every 10 years with health goals and metrics to focus on and track for the decade. Some metrics continue across decades, but priority areas change over time to meet the current health concerns. We thought by looking at the categories specific to older adults identified in 2020 for Healthy People 2030, this might also provide some ideas for programming. I am sure that you have noticed information requests and needs from your patrons regarding a number of these health concerns on the slide. Now, once again in the chat, can you share some of the program ideas for some of these areas? Even if you look at the Healthy People 2030, could you give us some ideas that we can kind of draw from these areas? For example, like are there things that we could create programming around, like oral health or any of the others that's listed above? Okay, all right, Tai Chi for fall prevention. Okay, dementia. Managing chronic conditions in big areas. Okay. Blood pressure management. Those are really great, okay, prevention care screenings. Yoga or chair yoga is popular. It very much is. Managing diabetes, chronic disease, self-management programs. Sharing a list of dental practices. Having a lab representative on elective tests. I'm figuring is having this various representative for testing days, so I'm going to go with that. If that's something different, absolutely correct me in the chat. Addressing isolation and mental health. It's in blood pressure stations for patrons. Very good. Healthy Heart Ambassador programs, connecting to transport options by the county or municipalities. Diabetes management. That's actually come up quite a bit in this chat. Support for relatives working with elderly, and dietitian hosted food related book discussion. Okay, these are great ideas, and like I said, we want you all to keep that momentum going, because there's opportunities for other libraries and things that you may be working in that this chat will give you a few ideas to help bring those things to fruition. Now, I'm going to pass it on to Benny, and she will discuss additional aspects of programming to consider.
Thank you, Shauna, and thanks everyone for your participation in the chat. That's great. The first type of programming I wanted to talk about is collections and then passive programming and reference. So consider starting with a review of your library's current collection and seek items to fill any gaps. So perhaps you have a lot of books about heart health, but none on another health topic. Or perhaps you're getting questions about a particular health topic and you would like to add something to your collection. Maybe there are resources in your things collection that you want to promote, or maybe your library offers take and make craft kits. I also hear about some libraries creating kits designed for patrons with dementia and their caregivers on a variety of topics for entertainment or to support reminiscing and connecting. Um, so those are just some ideas. And when we discuss passive programming, what we mean by that are self-directed programs. So this could be things like having a poster in the bathroom about hand washing, or having coloring pages out on a table, or posting a quote or a question of the week. You might want to develop a book display for a specific event or awareness celebration. And I heard someone mention family caregivers, so like for Caregiver Month. You may also choose to provide free printed materials from organizations such as the National Institute on Aging. And the National Institute on Aging has several publications you can download for free, and we'll look at some of those in a minute. And reference is another key important area, and curated lists of key or sensitive topics and knowledge of community resources will be really helpful here. So perhaps you want to create a LibGuide or a list of resources. And also being aware of resources in your community may help you feel, and information resources in general, may help you feel more confident when questions arise. Okay, so the last site I want to demo for you today is the National Institute on Aging, and it's again one of the National Institutes of Health. And let's head over there. So in addition to health information on selected health topics, it also has a lot of resources that can support programming at your library. So the National Institute on Aging has a ton of resources, and you can follow a lot of different paths to get to the information. And this information is going to be more directly related to older adults specifically. So we've included direct links to the pages that we think are most important on the handout. And I'm going to share some of those here, but don't worry about following the specific pathways that I'm going to demonstrate. Just want to give you a sense of some of the resources that are available. So just to start, I just want to point out from this homepage that you can also find information in Spanish by clicking on the Espanol button. And then glancing at the homepage, there are choices here in the navigation bar. There's also a place to get information on healthy aging, Alzheimer's, and more. We find information about funding opportunities. You can also browse health topics from this main page. The first one listed is high blood pressure in older adults. So I do want to take a look at this just to see what that looks like. So in this resource, there's a guide on the right side with some of the topics that are covered in the article. And again, this article is available in Spanish. And if we scroll down a bit, there is a PDF that can be downloaded and printed or shared. So lots of items listed under this one health topic. Now going back to our main page, I also wanted to point out at that homepage, there's information on aging research, There are resources specific for health professionals, such as tips for communication, healthy aging resources. And here at the bottom, there's a link to alzheimers.gov. So that is another resource that is available here. Now I'm going to head back to the top using this arrow on the bottom right. And let's start with this link for health topics. You can also reach that here from the main navigation bar. And this takes us to a page called Health Topics A to Z. So along the right side of this page, there are some highlighted topics. And then if we scroll down, you can browse A to Z. And I just wanted to give you a sense of the number of topics that are available here that might be helpful or of interest when you're planning programming or supporting a reference question. Each of these links goes to multiple resources for each topic. So like that high blood pressure page we looked at earlier. Again, you're going to use that arrow on the bottom to head back to the top. So I want to look at these other resources here and you can also explore. So there are publications for download. So these are examples of print publications that you could print for your library or organization or share with others. They're things that you might hand out at an event or post in your library or maybe have in a brochure rack. And if when we look at that brochures, they have some featured publications, but let's view all to see what's available. Okay, so there are some that are available in Spanish. And I specifically want to point out this one called the Caregiver's Handbook. So the Caregiver's Handbook is something that you can download and share or print. There's also some information, online health information, infographics, and videos related to that topic. We're going to head back over here. I want to point out that there is information for health professionals. And next, I want to point out this multimedia toolkit, which is just loaded with resources. So it's called Infographics, Videos, and More. So there are lots of infographics available. There are also publications. So we just saw this Caregiver's Handbook before. There are videos. Videos might be helpful for audiences who prefer audio or video content over written content. There are social media toolkits, scientific images, and more. I want to look at one of the social media toolkits, and I wanted to look at the Social Isolation and Loneliness Outreach Toolkit. I heard that mentioned in the last section. This is a really robust toolkit. It includes animated graphics, social media images, example social media posts that you could post. There's an educational flyer, again, health information, videos. So lots of resources here. These are things that you might post on your library's website or include in a blog post or a newsletter, or if you're putting together a LibGuide or other materials, these could all be things you might consider adding. We're going to head back to our previous page. I would like to look at those infographics. Okay, so I'm going to choose View All Infographics. So there are infographics on a lot of different topics, healthy skin, more about high blood pressure, clinical trials. And I specifically wanted to point out this one infographic, Take Care of Yourself as a Caregiver, because when we talk about older adults, we also think about caregiving. This infographic offers some suggestions of ways that one might use to care for themselves when they're caring for others. And additionally, if we choose caregiving from this tab here, we find even more resources related to caregiving. So there are caregiver worksheets. These are things that you could download, print, copy. There are many articles for different topics related to caregiving available here. And now we're going to head back one more time to that Health Topics A to Z page. So finally, in these explore topics, we have educational resources and toolkits. These are available for caregivers, for the general public, for healthcare professionals, the media and the press, and for students. And I want to review that toolkit for caregiving because there's something specific I would like to share with you there. So again, some of the resources have been highlighted before. We see publications, infographics, videos, but what I really wanted to point out is community resources. So these links uh, are um, are ways to find the community resources in your areas that could be helpful, such as the Elder Care Locator can connect you to resources in the area, and also the Area Agency on Aging can help you connect to your local Area Agency on Aging. So these I feel like are great, and there's also just some really interesting articles here on other topics that might be of interest. And the last thing I wanted to mention is in terms of multiple languages. So there are resources. So these would be directly related to older adults in multiple languages. And I find the easiest way to find these is to use the search box from the National Institute on Aging website and choose multiple languages and search. And we see a tab that says looking for health information for older adults in multiple languages. Yes, we are. So this is just to give you a sense of some of the resources, like Medline Plus, the National Institute on Aging also has resources in multiple languages. So hopefully these will be some great resources to use as you're thinking about your programming. I'm just curious if there are any questions about the resources on the National Institute on Aging before we move on.
There was a general question.
Okay,
Amy asked, are there other resources to order free publications? I had told her
so
that most places transition to download, but
unfortunately that is true. I do think
Mhm.
there are some that are still available. That you can order, but a lot of things that even we were able to get a year or two ago, right, Shauna, we haven't been able to, they've switched to download.
Right, because before I was able to actually get the booklet of that caregiver support, which is a great book, colors and all the things. But now it is the only option is to download as a PDF. But we will kind of have to review a lot of the other resources because some may have printable items, or excuse me, or they may still have that booklet. But I agree with pretty much everyone else. Most have kind of went to more of a downloadable option for their resources.
and that's it.
Okay. So I think I am passing it back to you, Shauna.
Okay.
Oh, let me get to your slides. Okay, there you go.
Thanks, Benny. And so, here we have different types of projects and programs that, as we look at the types of projects and programs, we recognize that many of you have either conducted a myriad of programming ranging from nutrition and food access, access to care, social work, or even memory books and memory cafes. We also recognize that there are some in this space that are still at the beginning phase of brainstorming ideas. This is a welcoming space for all, regardless of level of programming experiences. The hope is that through this conversation, we could help generate potential collaborations, provide libraries and organizations with additional resources in their toolkit to strengthen their established programming and or help others inquire about programs that could be replicated to meet the needs of the older adults they serve in their communities. And I kind of like to look at this is, this is where the magic happens. We want to see how we can kind of create that synergy with all of the great ideas and all of the great opportunities because you may already have a program, but just based off some of the tools or some of the resources available, these are ways that you can actually enhance some of that programming. Okay. And we have shared in this presentation quite a few ideas around programming for older adults. Now, if these stories don't have your wheels turning yet, we have more idea sources. So, but first, we would like to hear from you. Could you share in the chat about a program you have tried or one you are interested in trying?
Hey, Shauna, while we're waiting, there was a question about could you please describe memory books or cafes?
Sure. So, memory books and memory cafes, these are opportunities where they can bring in those individuals who may be having some memory issues at the library. And so, some of it may encompass kind of stories of the past that those individuals may remember. A lot of times they may be coming with a caregiver. So, maybe they are, showing pictures in the 50s or the 60s. So, to kind of get them reacclimated to a time that is very memorable to them. And also they also provide other resources like books on memory care and also support around those things. Every library is a little different in how they utilize those resources, but that has been pretty much that common goal around those. Um, the
And can
chat
I
is
also
going really quickly. Good.
Yes.
I'm
Can
sorry,
I jump
Lauren.
in too, Shauna, for just a second? This is
Yeah.
Benny. So I was just going to say that memory cafes specifically are social gatherings for people with
Mhm.
cognitive changes or dementia and their care partners. And these are non-judgmental spaces for people to have fun and connect. And I do just want to point out, I don't think we included this on the handout, I'm not sure, but Dementia Friendly America has a video that kind of describes what memory cafes are if this is a concept that's new to you. And they also have a directory to see if there's a cafe in your area. And there are some that are available completely online. There are some that meet in person, and they meet in a lot of different places. So just wanted to share that as well.
Thank you, Benny. And I see someone, they had some, we offer caring for caregiver and other that focus on dementia-friendly communities. So that's absolutely on board with what we're discussing today. Um, was a Healthy Heart Ambassador facilitated blood pressure self-monitoring program, focus disease self-management education programming, programs for assessing health care, information on GrandPad senior tablets. Now that sounds very cool. Getting very savvy with technology. And once again, like I said, feel free to continue to share as we move forward. I'm going to make sure I didn't miss any. Okay. Okay, so someone has done a play that was tailored to those with declining memory to help them engage. And that was very creative. Thank you all for sharing some of your insights. So you're still looking for ideas, you may find resources in those web pages from ALA that we mentioned before, and excuse me, the American Library Association. Our focus for this class is health information access, but there are lots of ideas for other types of programming as well. These programs may even have an impact on health as people experience social connections and meaningful experiences and interactions in the library. And I will briefly discuss these websites that are listed on this slide. So the first one is Let's Move in Libraries. It has program ideas, resources, and examples of library programming focused around movement and active living, advice for where to begin, accessible programming, and liability. Another resource from ALA programming, excuse me, is the Programming Librarian. You can browse and search library programming ideas. You might search by budget, by age group, search for health, get tips for planning, partners, marketing, budgeting, and other advice for carrying out the program. Web Junction, is Health Happens in Libraries. You can check on their resource list. This is less a list of ideas and more dedicated resources for you to develop health programming, including webinars, communication ideas, detailed examples of projects. It is a deep resource and a very much worth exploring to make your health program a lighter lift for you. With the Rural Health Literacy Toolkit, this is a clearinghouse and is specifically dedicated to rural libraries with a focus on health literacy. Ready.gov it has the emergency preparedness training and programs, social media toolkits, older adults, people with chronic illnesses or disabilities, and people with pets may all have unique emergency preparedness needs to consider. The NNLM past funding projects, you can find on the website. This link has examples of projects funded by NNLM in the past. While we do not have funding available at this time, you may still find some ideas to consider from previous projects. But I will encourage you all to kind of look at within your region for NNLM to follow them, because funding may come at different times for different regions. So absolutely follow up in your respective regions of the network of the National Library of Medicine. During the time, we're going to look at a couple of these websites. So the first one is going to be the Let's Move in Libraries. Let's Move in Libraries was an initiative that originated from the Let's Move campaign of 2010. The Let's Move in Libraries initiative provided grant-funded opportunities to libraries beginning in 2017 that focus on libraries and those within library settings that were responsible for developing programming focused on increasing physical activity and healthy eating programs, as well as providing libraries with actionable steps to develop programming focused on on overall health and well-being. As you navigate, we're going to look at the Get Started in Program ideas. And then we're going to go to the chair based exercises. And there are some. And when you look at the chair-based exercise, you can look at there are some tabs that will help you identify some of the different things you need to consider for these exercises if you're having a program. And so where do you start? Things to consider, what costs are associated, suggestions for assessments, and how do I talk it up? And they also have a list of additional resources available. One aspect of this website that we found in CYFA is that they include a lot of information about the Get Fit program as well, which was Jerry Fit, which was started in 2019. And it was really for sustainable active living programs for older adults. Many times we do not get the opportunity to hear from even the libraries who are actually exploring these particular opportunities for their population. And they were able to show or to highlight some of the programming that they were able to do when they had Jerry Fit in their library. So things that were working, things that they wanted to improve on, and just to keep individuals motivated. The Let's Move in Libraries also highlighted the AARP Community Challenge grants that provided annual funding awards to local projects that help make communities more livable for people of all ages. While there is currently no funding being offered for new projects, they have compiled various summaries of libraries that received funding in the past. I noticed that libraries in my area, I'm in Charleston, South Carolina, they were past recipients. And you can see in South Carolina, there was, grants funding, where the Let's Talk curriculums were built and fostering productive conversations around difficult topics. But they were absolutely ways that even for us viewing them today, looking at what the past funding opportunities presented, you may be able to reach out to your areas if you have some similar thoughts on creating some of the same type of programming in the area. Do we have any questions about the Let's Move in libraries?
So far, no questions.
Okay, all right. So now we're going to move over to the ready.gov. And on the ready.gov, we're going to click on the make a plan, older adults, and we're going to look at their emergency preparedness guide. And when you look at this guide, you can see that it already creates a checklist that many times when you're thinking about emergency preparedness for those who may be aging, things to consider when there's an emergency happening. Ready.gov can be viewed in both English and Spanish. And under their plan for the emergency preparedness, when they have this checklist, you kind of review it if you're experiencing an emergency personally or if you work with older adults. But what I do really like, this is my personal preference, that they give you space for you to include additional items to your checklist because they understand the needs of you and your community can differ geographically as well as based on age and other differences. Are there any questions about ready.gov?
No questions so far.
Okay. Okay. So now, so finally, we would like to share with some of you some health observances and awareness days that focus on older adults. Celebrating older adults with these monthly observances can further enhance programming, and some national associations and agencies provide additional information and toolkits to help bring awareness to health conditions and celebrate older adults that you can use. Some resources are free and or low cost to you. So now we want to open the floor up to any questions. Yes, Michelle, we will be providing CEU credits, and that should be the link will be sent out shortly too. Justin said, as generally curious what resources there might be for loneliness. Now, Benny, I know when we looked at some of the older adults, I think there was some information around loneliness as well. But just based on our presentations, we didn't include that, but we do know that that is really one of those high need areas for the aging population, just to be a focus on there. But I do believe with NIA and some of the other resources that we have provided, there quite a bit of resources focus on loneliness. So I definitely agree it is absolutely a big problem. Okay, so people are actually adding more awareness days that we need to include. So you have the Fall Awareness Month in September. Um, Tammy says she is a community health worker, and this is some great information. We never really have enough information for the elderly. Thank you, Tammy. Jamie said resources for navigating electronic health resources like health portals, which can be a major barrier to healthcare access and provider communicate. Absolutely, because a lot of things that we are utilizing for even seeing your doctor, it's a lot of it is using technology, even scheduling. So absolutely having some literacy around the use of that will be helpful for the elderly. So Connie asked the question, is there concern for liability? Can you explain that question?
While we're waiting for Connie, we do have two questions in the Q&A as well.
Okay.
Daphne asks, are there any resources on older adults and substance use?
I was going to say that's a great question. We didn't research that for this presentation, but can we look and see if for NIH if there is any substance abuse resources on there.
So you want me to take a look at that NIA?
If you don't
Sure.
mind,
Just see.
just to see, yeah, because there's so many other resources. Let's see.
It does not look like they are covering that here. This is something we can do some research on, or
Yeah.
if others know of some good resources, we're happy to share some things out with the recording.
And so somebody did mention like SAMHSA as a resource that may have some information on that. If we don't have it currently, we'll be
Oh,
happy to kind of research some of that for you.
there's something here for alcohol misuse or alcohol use
Hmm.
disorder. So yeah, why don't we do some research on that and
Yeah, that'll
share
be
what we
perfect.
find?
If we find any research on that particular topic, we'll be happy to share that with the group that's here as well.
And Connie said, for example, is there a waiver to be signed for chair yoga in terms of liabilities?
I wonder if they included anything about that.
And I'm not sure if they included, let's see, on there, things to consider. Because a lot of times based on, maybe where the event is happening, a lot of times they may already have a liability form or basically ideas of how they handle liabilities when it's in public spaces. But here again, if we can locate that, we may not be able to look at this very moment, but if we're able to find some on this resource guide, we'll be happy to share that as well.
Mhm.
Christine said most facilities require insurance, and the insurance may require a liability waiver. She states that she teaches Tai Chi and uses a standard form. Okay, Regina said, thank you, Regina. See, we are all working together. This is a very much team effort programming. This is what I mean when I say synergy. Regina has found on the Let's Move Libraries.org resource has example of liability
Oh,
forms.
there we go.
Teamwork.
We have another question in the Q&A, if you're
Okay.
ready. Arthur asks, any guides for how to be a good receiver of care?
A good risk sounds very personal.
Got
What I would say about that, those who are in caregiving, those who are, I feel like when you're doing the work, a lot of times it's actually difficult to receive help or support. We're so used to giving and supporting others that we may lack the idea of taking care of ourselves as well. So I do think, there's room and space for us to think about those who are creating the program. How can we look at self-care as something, even when a moment ago when Benny was sharing like some of the resources for the caregiver, there were different events on how you could potentially take care of yourself because you don't necessarily want anyone to tell you what to do, but you absolutely want to have options to think what's going to be best for you to work in that and work in what you're going to need for the future. Let me
it.
see. Nita has pages about substance abuse in older adults. Okay.
Oh, NIDA.
NIDA. Yes.
Got
I
another.
see. I knew this was a winning group because I knew there were going to be so many resources that we could be sharing amongst ourselves that we may not have highlighted before. Tammy added, it says also for some who may have ARP, they offer live sessions for people who are at home through Zoom. So if they cannot get out, and this is a resource, they can do Tai Chi and memory games, etc.
Along
Jamie,
those lines, sorry, Shauna,
go
can I just
ahead.
interrupt? One thing we didn't really talk about is the state libraries. A lot of state libraries
Mm.
have resources or have connections to other like state level programs that are available for folks too. So that's another place to look for resources.
We got a question from Kimberly in the Q&A. Are there any resources that exist for electronic health? I think that was a great question around that.
I think there are some pages in Medline Plus. I'm happy to go check that out. So I'm assuming this is about like utilizing electronic health records.
She didn't specify. So Kimberly, if you could let us know what you were thinking, that would be great.
Oops, we had it. So there are some resources here that would be useful maybe to check out. So that might be a place to start. It's kind of outside of our scope, but
Yeah.
looks like there's some resources here in Medline Plus that might be
Uh,
helpful.
but she said not the records, but the portals.
Oh, yes, right. And a lot of those are very specific. My understanding is a lot of those are very specific to the portal itself. But maybe I'm just throwing this out as an option. Maybe if there is a healthcare organization in your area that could come out and provide some programming around that, that might be a potential way to support. And for the library staff also to learn about ways to support people who are utilizing those portals.
We got another question. Are there any resources for a person advocating for themselves or a loved one?
Like with a provider, a medical provider, I'm not sure.
If this person from Afton HPL could share, that would be great.
Because I love this resource, talking with your doctor. I don't know if this is at all what you're talking about, but this is a great page on Medline Plus that has just a lot of resources about preparing for a doctor's appointment, questions to ask, things you might want to, ways to prepare for appointments and things like that. The other thought I have is the Area Agency on Aging. It is my understanding that there's one in at least every state, and some states have multiple. And these are folks that would have a good sense of what resources are available. And I think that would be a good place to start in terms of getting assistance with advocating.
And they confirmed yes with providers, so that was perfect.
Oh, okay. So yeah. So I really do, for any audience, I love this talking with your doctor, and it does link out to other um, institutes, so other National Institutes of Health that also might have specifics to their, like to the National Institute on Aging or others.
This was just a broad question from Connie. Connie asks, I'm thinking of using health applications, some of which might be available with an Apple Watch. Has anyone done something like that? So if you've done something, please share it in the chat. And I think those are all of the questions. There was just one comment. Kimberly says, I work in a public library and have created a social space for those who don't have an outlet to connect with others.
That's
So
great.
yeah.
Mhm.
And one more question. One looks like it got cut off, so if you could complete it. They started off with one of the issues that I've come across are with those struggling with losing their independence. So if you could finish that question, we would love to help answer your question about that. But as of now, that was everything.
Okay. And I just think that getting in touch with those area agencies on aging can be extremely helpful, I think. And so maybe we should go ahead and share just the CE code and things like that.
Sure.
Is that good?
Yeah,
Oh, so Shauna, I think
I got
Yes.
it.
Okay. Well, once again, thank you all for sharing all of the different resources and, even links that I see that are populating in the chats. from even some of the resources that we've used today. So that's very helpful. We just wanted to share some other upcoming classes that are happening soon. There is no cost to attend any of our classes. You just need to create a free user account to register. We mentioned earlier there will be offered, clinical trials will be offered August 20th. Um, August 25th will be health program at your library. And then we have to sign up for upcoming additional classes in November.
Oh, sorry.
Do you want to? I was
No,
gonna.
no.
Yeah, well, I think if there are any other resources in November in celebration of Rural Health Month, we'll be offering a Rural Health series. Most of the events are still in the planning phase, but you can check out our training calendar in the next few months, and those classes will be posted. I know that we will be offering rural health resources again as part of that series. So we actually just offered that class, I want to say yesterday, and the recording should be posted within the next day or so on NLM YouTube channel. And there are links to previous class sessions on the handout as well. So
Okay, sorry, I didn't
next
mean to
up,
cut you off
Benny.
before.
Yeah, I'm gonna
Okay.
toss it to Benny.
Okay. So, yeah, so today we do have an evaluation form, and after completing that evaluation, you'll be offered continuing education credit from the Medical Library Association, and also we're going to get to CHES. But you don't have to be a member of MLA to receive the credit, but you will need to create an account for their continuing education site, and we've included this slide to help you redeem those continuing education credits if you're interested in these. This is included on the slides, and I just want to so this class covered a lot of health information resources that we call consumer health information, and this means that that health information is for everyone and is geared toward the general public. So the 1.5 hours of credit from attending today's session could be your first credits toward achieving your MLA Consumer Health Information Specialization, or CHIS. By earning CHIS, you are getting the skills and knowledge to become a confident expert provider of health information to your community. And we do have more information here about the specifics, but the important things to know is that NNLM offers all the education and classes that are needed to earn the CHIS. And at this time, NNLM will cover the fee for that specialization, for the certification, or the specialization. Do please reach out to any of us if you're interested in that and would like more information. Also, let me just scoot something. So if you're a CHES attendee, your attendance can be applied to respective continuing education contact hours programs. So CHES stands for Certified Health Education Specialist, and CHES attendees should complete the evaluation as well to register your attendance and receive a certificate. And just of note, you will need your CHES ID number to complete the evaluation. And I'm handing it back to you, Shauna.
Thank you. Okay. So, thank you for attending our session. Here is our contact information if you would like to connect with us. We'd be happy to hear from you. This is the end of the content for today. The last thing we want to share is the link to the evaluation, which is the first step in claiming continuing education credit. But whether you are interested in receiving credit or not, we would value your feedback and would appreciate it if you would complete the evaluation. So there's always room for improvement. We want to know what's working and what things we can do to enhance it to really to help support the needs of the communities and also the ones that you all serve. So we just want to thank you for your time.
Oh, Benny, could you go back to your contact info? Somebody was wanting to see that again. There we go.
Thanks for watching. This video was produced by the network of the National Library of Medicine. Select the circular channel icon to subscribe to our channel or select a video thumbnail to watch another video from the channel.